Hello, my name is Mifra Khan, and I'll be narrating through our quality improvement project submission for the 2026 QueSST competition. Participants for our QI project, Improving Diabetic Foot Exam Rates, included Dr. Ahmed Daher, Dr. Maan Faraj, Dr. Mifra Khan, Dr. Bela Khatun, and Dr. Andrew Pham. Our faculty advisor was Dr. Fatin Sahar, and our project was completed at DMC Grand River Health Center. As family medicine physicians in the outpatient setting, preventing and treating complications from type 2 diabetes is something we take part in on a daily basis. Our team had noted there was a gap in the quality of care we were trying to provide, in that there was a low rate of diabetic foot exams documented in patient charts. This resulted in missed opportunities for early detection of peripheral neuropathy, foot injuries, and other foot complications as a result of type 2 diabetes. Given our significant rate of missed opportunities, we created a project to increase the rate of documented annual foot exams at our clinic, thus improving early detection of peripheral neuropathy and reducing preventable foot complications from type 2 diabetes. Our project was completed at Grand River Health Center, where our participants see patients twice a week from the clinic's patient panel. We initiated modifiers to our workflow on December 16, 2025, and started collecting data, with the last day of collection on January 14, 2026, giving us 1 month to complete our data collection. In addition to the 1 month of data collection with workflow changes, our team analyzed data retroactively, spanning from October 16, 2025 to December 15, 2025, to see how often type 2 diabetic patients were completing their annual foot exams. Our baseline rate of documented diabetic foot exams was 16%. We had set a target goal of improving to 50% completion, but we're happy to see with our new methods, we were able to significantly surpass that, increasing to a 72% rate of completed diabetic foot exams. Our intervention required several steps. We first educated the medical assistants on our supporting staff on the possible complications of type 2 diabetes and why a diabetic foot exam was recommended annually. We asked our MAs to screen patients during intake to see if they had type 2 diabetes, and if so, was there a diabetic foot exam completed over the past 1 year? When due, MAs asked patients to remove their socks and shoes before the resident physician entered the room. This served as a visual cue for the physician to complete the diabetic foot exam before the end of the encounter. Our intervention was successful, with an increase from 16% diabetic foot exam completion to 72% completion rate, surpassing our goal of 50%. Our team was involved in designing the project. This included identifying the gap in quality care in regards to the low rate of annual diabetic foot exam completion, as well as defining the improvement measure to increase the rate of annual diabetic foot exams. We collected data pre-intervention to serve as a baseline rate of foot exams. We also took initiative to educate medical assistants as to why diabetic foot exams were an important part of diabetic patient care and how to modify their workflow for optimal results. After our 1 month period of intervention, we collected and analyzed our data to assess improvement. At the conclusion of our 1 month intervention, our team was able to make an impactful improvement in the quality of care for our type 2 diabetic patients. With a simple workflow change and help of supporting staff, we had an increase of diabetic foot exams from a baseline of 16% to 72% in just 1 month. Because our methods were so successful, it has been permanently implemented into our clinic's workflow in an effort to continue to close the gap in the quality of care our patients receive.